And we are back for part 2 of this month's Medoscopy procedure with Nicole Abrams, a certified women's health nurse practitioner with the Hofberger Breast Center at Mercy. Thanks for joining us.
Thank you for having me, Dan.
Are you a native of Baltimore? Are you from here
I
originally?
am.
You are? All right.
Born and raised in Baltimore. Lived in Philadelphia for a little while for school, but now I'm back here permanently.
Did you like Philly?
I love Philly. It's not very different than Baltimore, but it was a great place to do school and learn a lot.
I used to have a friend walk their dog in Rittenhouse Square. That was always a fun place to check out.
Yeah.
But you're in Baltimore now, so what about Baltimore do you like?
It's home. I was raised here. All of my family's here. It just feels like the place to be. You get a little bit of everything. You can have the city life. You can also go on the outskirts and enjoy some of the county and countryside. So you get a little bit of everything.
Yeah, a lot of people say Maryland is America in miniature. And so we got a little bit of everything here in the state.
Yeah.
So what exactly, for folks who don't know, is a women's health nurse practitioner?
It's very similar to a family nurse practitioner, which is someone who practices kind of primary care. But women's health has a special focus on women and things like gynecology, breast surgery, things of that nature.
Is medicine something you've always had an interest in?
I did. Growing up, I used to think that I wanted to be an OBGYN. But when I got to college, I realized that I wanted to be more hands-on earlier and more like at the bedside with patients. So I took the nursing route instead. But I always had a passion for women's health. So I knew that eventually I wanted to get into that, and I did.
So that was something like you had always thought about? You didn't have any other possible aspirations?
As far as I remember, I used to watch the Cosby Show, and I always was like, oh, I want to be an OBGYN like Bill Cosby was. And
Dr. Huxtable.
Yeah. So that was when my interest first peaked. And it kind of just continued. I knew I wanted to be in medicine. Medicine was always interesting to me. But I have a passion for women's health, and that's where I kind of fell in line. I did a lot of different nursing as I was getting prepared for my women's health role. But obviously just wound up being in women's health, which is what I wanted to do ultimately.
What do you like about nursing?
I really like the patient interaction that you get and how you get to develop a relationship with your patients, and they become, in a lot of cases, like family. And being able to help people, community outreach, being knowledgeable, dealing with different populations, exposing myself to different situations and different types of people, all of that is fun.
What part of it isn't fun? What are the challenges?
It is very demanding in some cases. I currently work with a lot of pretty ill people, which can be hard sometimes. But a lot of times the most difficult situations wind up being the most rewarding. And so in most cases, it winds up being very rewarding. And so it makes the job not as difficult.
So you're working in the breast center, so you're dealing with a lot of patients who are maybe dealing with some pretty difficult diagnoses.
Yeah.
What's that like? Having to work with the patient. Maybe you just found out that they're dealing with breast cancer.
There's a whole ton of different reactions that patients give to finding out that they have breast cancer. But surprisingly, I found that it's more rewarding than I thought it would be. So when I first applied for the position, I was like, this could be tough, being in a field where predominantly majority of my patients have either a history of breast cancer or high risk for breast cancer or are active cancer patients. But being in this field over the past 3 years almost now, I've realized that there's a lot of good outcomes, probably more good outcomes than there are bad outcomes. So it makes the job, a little less stressful, knowing that most all my patients have a chance to beat this.
Take a brief break and be back for the next part of Medoscopy.
I'm Dr. Gauri Bedi. I'm the Associate Director of the Hofburger Breast Center at Mercy. We have a great breast center here which provides comprehensive care for patients with any kind of breast problem.
Breast Center at Mercy has been open for over 20 years. We take care of women with diagnosed breast cancer, women with benign breast disease, women who are at high risk for developing breast cancer.
At Mercy, we're proud of how we have a sort of complex, holistic approach to our patients.
We take care of them from diagnosis all the way through treatment, follow-up.
It's wonderful to actually have all the components to treat a breast cancer patient comprehensively here.
Plastic surgeons and the breast surgeons work together so well for the patient, individualize their care, which is what I think every woman deserves.
Breast cancer treatment is not a one-size-fits-all. It's very individualized, so being able to do a patient-based approach is very helpful.
Each individual physician treats each individual patient as an individual person because they have different wants, different desires.
When I first meet the patient, they're sometimes overwhelmed with the amount of information they're given, the amount of choices. And if I just come out and tell them, this is something we can definitely take care of, then we can get to what are the best treatments for them.
In today's world, it's not just one person who's taking care of the patient. It is a team effort for integrated treatment so that you give them the best possible care.
As frequent viewers know, one of our regular features on Medoscopy is a kind of show and tell, where guests bring in something, could be a book, photograph, we're not sure what it's going to be, but it's important to them, symbolic of who they are and what they're about. Nicole, what you bring?
So I brought one of the photo books that I frequently create of just photos from a memory that's important to me. This one is of a family trip to Disney. And so you'll see majority of my family here on the front. And it just, whenever we do things, family's super important to me. So whenever we do things, I like to have a memory of it. And this is how we do that.
So did you have fun in Disney World?
I did.
When did you go?
So this was in 2023.
Oh, you were there at the same time I was.
Yeah. But we've been back since then. We went last October.
So did you get to check out Galaxy's Edge?
We did.
Yeah. Did you go through
Very
that whole
nice.
ride with the stormtroopers and everything?
Very fun.
Yes. Did you get to go more than once?
So no, I did that once.
Oh.
Just
My wife and I
once.
wanted to try to get in line again, but it
Yeah.
was tough.
Yeah. It's a long line.
It's a long line. Did you do the where you get to fly the Millennium Falcon?
Yes. So I didn't actually do that one, but my sister did. Yeah, and she said it was fun. Those lines are long, so you have to really plan things out.
Yes. We were very lucky in that regard. My wife made a connection with some folks that's all they do. I mean, they're travel agents only specifically for Disney. They won't do anything else. And she started planning like a year in advance.
It's a lot of planning.
Yeah, it is a lot of planning. But it's, keeping on the health message, you cannot get fat at Disney World because you are walking all the time.
Yeah. Make sure you wear comfortable shoes because you walk the entire time. But it's worth it.
It's like 20,000 steps or something
Easy.
like that. I know my hips were hurting me after doing that walking, but it was like, it's good for you. So you actually just started to answer my next question. When you're not dealing with patients, what do you like to do?
Yeah, family. Family is everything to me. I love to travel, so we do a lot of that. I do like to shop, so that's something that I will do occasionally. But family is really the most important thing, so I try to find time to spend with my family and close friends when I'm not here at work.
So do you feel that you have achieved some work and home life balance?
Yeah, I do believe so.
Well, you're the first one to tell me that. So congratulations, you won a prize. No, I'm kidding.
Yeah, I think, I always say you make time for what you enjoy and you want to make time for. And so I tried to do my best to make time for my family life and my home life. I enjoy my job, but it is not as important as my family is. And so I like to make sure that I keep that a forefront in my life.
Well, there's the saying that you've got to take care of yourself, because if you don't, you're not really going to be able to care properly for anybody else.
Absolutely.
So that's a good message. Anything else that you're particularly interested or passionate about? Any particular hobbies, things that you like to do in your ample leisure time, as I like to joke?
So I do enjoy working out, do a lot of strength training. That's a huge part of my daily routine. It helps me to kind of release stress and stay healthy, which is also important. I like to read, so that's helpful. It helps me to learn and also take time and just get away a little bit. But traveling is probably my biggest hobby.
And do you have a particular favorite places you like to visit?
Recently went to Turks and Caicos, and that was really, really nice. I'm a big island person, so anywhere island with an island is where I want to be.
Oh, well, that's cool.
Yeah.
Well, Nicole, I want to thank you for your time and your candor. I appreciate you sharing a little bit about your life. And thank you for watching. On behalf of myself, our guests, the Mercy staff, and the Sisters of Mercy, we wish you good health and humor. And until we gather again, may the road rise up to meet you. You stay through the credits for Wait Doctor, I forgot to ask, though actually to be more accurate, it's Wait Nurse, I forgot to ask. This is where we discuss the question each provider wishes their patients would ask but don't, or that most unusual hand on the doorknob question posed by a patient at the end of their visit. Any questions in either one of those categories pop up in your mind?
I guess what could they do outside of, medications and things like that to decrease their risk for developing breast cancer? And there are a few modifiable risks that you can do, like exercise, maintaining a healthy BMI, and eating a diet that's high in fresh fruits and vegetables, low in processed meats. Making sure that you're staying active and making sure that, you don't smoke or drink. Those things do increase your risk not only for breast cancer, but other cancers as well.
You mentioned diet just there. Is that something you advise your patients about a lot?
Yes, absolutely.
Do you find they need some guidance in that regard?
Most people do. I think we have a lot of resources available to us now, so a lot of people come knowing a lot of these things, but not always.
I know Mercy has the, I call it the farmer's market every Wednesday at 11 a.m. It's nice to see, we see both staff and patients lining up to check out the fresh produce. I always try to be first in line if I can get there so I can get the best stuff. But yeah, absolutely. I mean, in my field, I see so many questions coming out about diet. People have so many different questions, and
Absolutely.
And it changes.
It does.
It's like 20 years ago, eggs are bad for you. Then 10 years ago, eggs are good for you. Now, good and bad for you. So we can't quite figure it out. So, having someone like yourself who's educated in this arena to help people, it's bad enough you're trying to deal with a cancer diagnosis, and now you're like, well, I might die. What am I supposed to eat? I'm like, I don't know. So having someone, okay, here's what you might be wanting to think about so that you have a good result.
Absolutely. And I always don't have the answers either, but we do have resources available for dietitians and nutritionists and things of that nature who that's all they do is follow, diet and nutrition and things of that nature. So
yeah, all under one roof right here at Mercy Medical
all
Center.
here.
Okay. Thanks again.
No problem.